Hello again, this is Dr. Elkhammas. We are going to continue with our book, The World Medical Association Medical Ethics Manual. You see here the cover page as well as a link where you could find the actual book. It is available on the online on the website of the WMA as a PDF file. You can download it. That way you can follow readings if you like, or you even read before the lecture. The methodology, or the way I am going about it, is that the book is divided into a series of mini talks. So each mini talk will cover a few pages of the book. Each mini talk will give you a different message, so you will learn new information, new pieces of information each time you listen to one of the videos. And by the end of the book, hopefully we're going to finish the entire book, you will develop a good handle of basic medical ethics, as well as you become more familiar with the vocabulary, and you will be ready to, if you want to do any further readings, you will be ready to do so. During the series, I'm going to, every now and then, I may put a link to additional material that's available online, either usually an article or something like that, so to help you if you are interested. So why I selected this book, several people have asked me. It's really very simple. The book covers the basic knowledge of medical ethics. It is easy, clear. It was put together by an international group of authors, came from different backgrounds, different religions, different cultures, and that by itself is very difficult. So to have them agree on principles, a set of principles of ethics is I really think is very important to all of us. And the WMA actually wishes and love to have medical school adopt the book as part of their curriculum. And the best of it is available free online as a PDF file. So today we're going to continue with talk number 2, chapter 1. As usual, the book has a lot of questions, so today we're going to be dealing with some of those questions. The first question is, who decides what is ethical? This is a general question, and we'll specify the answer for the healthcare professionals, as well as does medical ethics change? Also a very reasonable question. The lesson today starts at page 19, again from the WMA Medical Ethics Manual. So on page 19 you'll find this question: who decides what is ethical? Yeah, it seems the medical community have agreed that, actually even community at large, that ethics is a pluralistic thing. What's meant by pluralistic for the non-English speaking? That means متعددة أو تعددية. So pluralistic means people really, it is okay, they may not agree on one thing, and it's not unusual to see people disagree on what's right and what's wrong. In certain situations, it's really, there are certain principles very difficult to disagree on them. So some societies have accepted that this disagreement is proper and normal, and they tolerated each other and lived. Some other societies did not accept that. It was very difficult. Either they were influenced by culture or religion, and ethics is more or less a very, very unified behavior, or a very unified set of rules. When you see, for example, the Universal Declaration of Human Rights, Yeah, those are very difficult to disagree on. I mean, most of the human being accepted them. For example, the right to live, and to avoid cruelty, and access to health care and so on. But we're still left with the question, who decide what is ethical for the healthcare professionals? Think about it yourself as a student or as a doctor. So during the medical school, you have learned a few things, or you may have taken a course in medical ethics, but then you add to it the oath. Every school, they have oath when they graduate medical doctors, and that oath has been there for thousands of years, and keep changing, and keep changing from culture to culture. And the code of ethics is probably every association or society, medical society, they have their own code of ethics. Organization, they have their code of ethics, and they have ethical bylaws and rules and so on. Sometimes, of course, there's a little bit of overlap between the ethics and law, and there could be a little bit of confusion. We may get to it later on. And some organizations are influenced by religion, so their set of rules are really based on their religion, and they follow them and so on. In general, for the doctor, what you read and what you see and what you watch, like in this video, and you confirm it by reading the book, usually just guidelines. But in reality, it is you who decide, because you're the one who is going to see the patient, and live the situation. You decide what's right, what's wrong, what's ethical, and what is not ethical. As when you examine him for the medical problem, you decide whether this is bronchial asthma or not. You decide whether this patient has hypertension or not. You decide whether this patient is diabetic or not, and usually based on your knowledge, experience, blood testing, and so on. In this case, your knowledge, experience, and it would be nice to know that there are some guidelines that the other healthcare professionals and your colleagues and doctors have agreed as principles, and that's how they're going to do their medical practice. So those guidelines will work as a roadmap for you, but it's really you who decide what's ethical and what's not during these specific situations. That's why medical ethics, when you really explore it, you will learn the analysis and reflection on the medical behavior of at a particular situation. So it helps you, and we will get to clinical ethics and other parts of lectures after we finish the book, and we will give some example how to really analyze an ethical situation. Now we switched, or we moved to the second question: does medical ethics change? This question is handled pages 21 to 23. And what do you think? Does it change, or it's really fixed for all these years? Of course it changed. If you remember, many years slavery was accepted, and then people became more civilized, and slavery is not accepted and forbidden. Same thing in the practice of medicine. Until probably in the 70s, it was mostly paternalistic. What paternalistic means for the non-English speakers? It means التصرف الأبوي. So like the doctor is like the father, and the patient is like the child, and whatever the father says, the child does. So really, the patient doesn't have much say. Patient comes to the doctor's office, and they tell him the diagnosis, they tell him the treatment. You do it, or you need surgery, you come next week, it's done, and that's it. Actually, some places they don't even take consent from the patient. But slowly, people started becoming more aware that the patient has rights and they need to be consented and they need to agree to the treatment and they have a say and they're partner in the situation. So this book, for example, mentioned the WMA Declaration on the Rights of the Patients that was published in 2005. The first sentence in that declaration says the relationship between physicians, their patients, and a broader society has undergone significant changes in recent times, which is true. Major changes. The declaration is could be actually discussed in a lecture by itself. So therefore, I put a link to it. I highlighted it in yellow in the lower part of the slide, and it's also available as a PDF file if you want to go and check it for yourself. On page 22, the authors of the book state that it is expected that the physician always acts according to his or her conscience, which is true, however, they are requesting a little bit more. They expect you to make an equal effort, real effort, to guarantee patient autonomy and justice. That way, you're really doing the right thing. And how you guarantee that? You guarantee it by learning and by experience and by talking to others and asking your mentors and so on. The authors also mentioned that the spread of knowledge these days, it could act as a challenge to the patient-doctor relationship. So these days the knowledge is available on Facebook, on Google, on the internet, many other places. And sometimes the patient comes in already have searched and has preoccupied ideas of what he wants, and he consults you, and it does really add. So if your answer is different from what he is thinking, it could create some tension regarding doctor-patient relationship. So certainly has changed, no doubt. Another thing that have happened, and the book mentioned that, is the accountability. The doctors, who are they accountable to? Until recently, they are accountable to God, they're accountable to themselves, they're accountable to their colleagues, and so on. But things are changing. Now they are accountable to patients, to their families, to hospitals, to other organizations, to licensing organizations, الأماكن اللي بتعطيهم الرخصة. So if you don't fulfill certain criteria, you may not get the license. This is the way it is. They are accountable to government regulations. So medical ethics is not as simple as 1,000 years ago. Now a lot of accountability, and keep it changing as medical technology change and more advances are made. Nowadays, actually, when you come to the allocation of scarce resources, the resources that are really not enough of it. So how you allocate it, how you divide it, is as we are, for example, now people are discussing widely the issue of the vaccine for the COVID-19. It is universally being discussed which country gets it and which country get less, and how much each country will get. And then within the country itself, they are discussing who would they give the vaccine first to: younger people, older generation, doctors, healthcare workers, and so on. So scarce resources is falling also on the shoulders of the physicians. So many changes keep happening, and you need to familiarize yourself with these changes as a physician. On page 22 and 23, the book mentioned few things that are controversial and accepted in one place and not accepted in another place. Sometimes the differences are within the culture itself, like abortion, assisted reproduction, genetic and cellular therapy, electronic medical records. So all these issues created some challenge and discussion in the medical community worldwide. On the other hand, I mean, with all these discussions, the medical profession has really remained very well respected, and we have to stay focused on the core: compassion, competence, and autonomy. Autonomy for you, you want to act as autonomous physician. You don't want to be influenced by other preoccupied ideas or prejudice or biases or so. And also the patient, you want to have them as partners, so they need to have the right for self-determination or to be autonomous. I think this will be the last slide. I want to thank you for watching and for listening. If you have any questions, please don't hesitate to email me or write them as a comment in the channel. I appreciate your support. It was really great. It's very encouraging for me to continue giving these mini talks. I do believe in mini talks, and I believe that they give a message, and people are very busy. They don't have half an hour and 45 minutes to listen. So next week we'll discuss a different question from the book, and maybe more, depend on the time and how easy to answer the question. So the question we're going to start with next week is, does medical ethics differ from one country to another? And the video after that is really also going to be great, because we get to the concepts and new vocabulary you have not really came across to in the past. So I appreciate your help, your criticism, your listening and watching, and your support. If you feel it's useful, please share it with your friends. Ask them to participate and become members and subscribe to the channel. And have a wonderful week. So I'll try to see you every Saturday. Thank you so much.